Hi, I'm Robert F. Kennedy Jr., your HHS Secretary. Welcome to The Real Food Show. Thanks to President Trump, we flipped the food pyramid and put real food back where it belongs, at the center of the American plate. I'm traveling across America, connecting with renowned chefs to show families how to cook delicious, nutritious meals with real ingredients, all at affordable prices. America, it's time to eat real food. Let's get cooking. Hi, I'm Robert F. Kennedy Jr., your HHS Secretary. Welcome to The Real Food Show. Thanks to President Trump, we flipped the food pyramid and put real food back where it belongs, at the center of the American plate. I'm traveling across America, connecting with renowned chefs to show families how to cook delicious, nutritious meals with real ingredients, all at affordable prices. America, it's time to eat real food. Let's get cooking. Hi, I'm Robert F. Kennedy Jr., your HHS Secretary. Welcome to The Real Food Show. Thanks to President Trump, we flipped the food pyramid and put real food back where it belongs, at the center of the American plate. I'm traveling across America, connecting with renowned chefs to show families how to cook delicious, nutritious meals with real ingredients, all at affordable prices. America, it's time to eat real food. Let's get cooking. Hi, I'm Robert F. Kennedy Jr., your HHS Secretary. Welcome to The Real Food Show. Thanks to President Trump, we flipped the food pyramid and put real food back where it belongs, at the center of the American plate. I'm traveling across America, connecting with renowned chefs to show families.
Press conference with remarks from Health and Human Services Secretary Robert F. Kennedy Jr.
Thank you all for being here, and I want to begin by thanking my good friend, Chef Robert Irvine, who is revolutionizing today the food on military bases across the country, and we're going to turn them loose on the school lunches very soon. Robert has been an extraordinary partner to me in the MAHA movement. I'm grateful for his efforts to help Americans rediscover the power of cooking real food. Today, we're taking another step to make America healthy again with the launch of The Real Food Show, a new series that makes healthy, affordable cooking simple and accessible for every American. This is not just another cooking show. It's about helping Americans take back their health. Over the past 18 months under President Trump's leadership, we fundamentally changed the federal government's approach to nutrition. Together with Secretary Brooke Rollins, we released the new dietary guidelines with one simple message: eat real food. We're removing petroleum-based dyes from our food supply. We are reforming the GRAS standards so that Americans know what chemicals are in their foods. We have 10,000 ingredients, chemical ingredients in our foods. The Europeans only have 400. We're bringing nutrition back into medical education. We're making hospital food healthier. We're reforming SNAP by working with states to stop taxpayer dollars from going to candy, to soda drinks, and to ultra-processed foods. And we're developing the first federal definition of ultra-processed foods. We're changing that policy. Now we're driving change in America's dietary culture. The Real Food Show is one way of doing that. Every episode shows Americans how to prepare delicious, healthy, budget-friendly meals using real, everyday ingredients. Every recipe uses whole food ingredients, works in a basic home kitchen with everyday equipment. It's family-friendly. It's approachable to cooks of every skill level. And every meal costs less than $5 per serving and aligns with the new dietary guidelines. We're not just telling Americans to eat differently, we're showing them how. And we're proving that eating well does not have to break the family budget. For too long, Americans have been told that they had to choose between healthy food and food that they can afford, and that's simply not true. Our first episode features Chef Andrew Gruel, and together we prepare salmon cakes with bean and arugula salad. The entire meal costs only $4.91 a serving. That's less than most fast food meals. One of the most affordable things you can do for your health is to cook real food at home. But this show is not just about food. America's chronic disease epidemic is not the only crisis we're facing. We're also facing a malaise, an epidemic of loneliness and isolation that's driven suicide rates in our children to the top killer of American teens. And drug overdose is number 2. Somewhere along the way, we stopped gathering around the dinner table. We're losing connection with these kids. Our children are growing up isolated, fragmented, atomized, and that epidemic, that malaise of isolation is fueling this epidemic of depression and mental illness. We lost one of our oldest traditions that binds families and communities together. The kitchen is one of our first classrooms. It's where children learn patience, responsibility, generosity, and healthy habits. It's where parents pass traditions from one generation to the next. It's where families build memories they will never forget and engage daily in that sacred ritual of cooking a meal, of creating something beautiful, and then consuming it with their family around a table. Breaking bread together strengthens families, it builds communities, and it nourishes both body and spirit. The Real Food Show is not just about cooking, it's about helping Americans reconnect with one another. This matters because America's chronic disease epidemic did not happen overnight. For decades, we've replaced real foods with ultra-processed foods. We've normalized convenience instead of nutrition or the social bonds. The consequences are everywhere. Today, nearly 90% of our healthcare spending goes toward treating chronic disease. Nearly half of every federal dollar goes toward healthcare. 1/3 of American teenagers now is diabetic or pre-diabetic. Childhood obesity has reached historic levels, and 77% of our children cannot qualify for military service because of obesity or chronic diseases. The good news is that Americans are already making healthy choices. Between June 2025 and June 2026, real food outsold highly processed foods by 7%. Yogurt sales increased by 15% as more families embrace nutrient-dense fermented food. Americans are showing they want real food. Our job is to make that choice easier. That's why every episode focuses on simple techniques, affordable ingredients, and meals that families can actually make on a busy work night. You don't need an expensive kitchen or specialty ingredients. You need real food and the confidence to get started. I hope every American watches The Real Food Show, available now on my YouTube channel, Secretary Kennedy, see Secretary Kennedy. Pick up a spatula, try one of our recipes, discover how affordable healthy foods can be. Invite your children into the kitchen, start new family traditions. The Real Food Show is about reclaiming something that we've lost: our health, our confidence, our connection to one another, and the simple joy of gathering around the table. When millions of families make changes like these, they become lasting cultural change. That's how we make America healthy again. Thank you, Chef Robert Irvine, Chef Andrew Gruel, and everyone who helped bring this show to life. And thanks to President Trump for making nutrition and chronic disease prevention a national priority. Thank you.
So the coolest thing about this program is, hey, we're getting people in the kitchen again. And we're getting kids to be around the kitchen with their families, to understand food, to purchase food, to see what green vegetables look like. And for me, the Robert Irvine Foundation, we run this. It's called Breaking Bread with Heroes. We have done it today here in the military base. We've modernized the military feeding. We're now modernizing military school feeding. Now we're modernizing America. We're teaching them how to cook. And by the way, in case you haven't noticed, I don't wear a suit. I wear this jacket. That means I cook for a living. So for me, it's really exciting to partner with the Secretary to say, hey, look, simple food you can cook with your family that gives hope, puts people around the family table. And it's so funny because I wrote a book called Family Table about putting the phones down, getting kids involved in eating healthy, nutritious foods. Because what kids do, and you know this, they go, oh, I don't like that. When you cook it differently, they love it. So I'm really excited about the show. I'm excited to partner with you on so many different levels, sir. To me, making America healthy, and let's think about that, healthy. You've heard the numbers from the Secretary. I'm a cook, I make eggs. I just want to feed school kids, military folks, and make America healthy. That's it.
Thank you, Chef Robert.
That's good.
Let's make America healthy again.
And I'm sure you'll have questions for the Secretary.
Any questions? Hi, Secretary Lexi Brody with WWNY. Can you talk a little bit about the interagency relationship between the Health and Human Services and the Department of War regarding the recent Ebola quarantine here on Fort Drum, and just talk a little bit about how that went?
About the Ebola quarantine?
Yes.
Yeah, I mean, there were a group of people, I think it was 22 people.
14.
What?
14.
It was 14 people who came back, who had been at the DRC and who violated the Title 42 order that requires Americans coming home, people who've been in the DRC, to quarantine before they come home for 21 days. They evaded that by going through Canada and trying to cross the border there. They were stopped on the border. They were initially moved to Fort Drum for evaluation. And then after that, after we made sure that they were stable and that they weren't infectious, and we had made agreements with the separate states in which they resided, they were allowed to return to their homes under strict monitoring protocols that we have agreed to with the states.
Do you think Drum did well in that?
They were incredibly accommodating on a very, very short notice. A lot of this was, a lot of the discussions about this happened in the middle of the night because we wanted, there were issues including the potential of infection and we needed a lot of cooperation, and we got that from Fort Drum.
Thank you, Secretary. I appreciate it.
We would ask that you keep your questions to today's announcement.
Mr. Secretary, Jonathan Wheeler with the Watertown Daily Times. Can you take me through, you mentioned the price kind of aspect of the way that people can't afford the food, the most healthy food. Why do you think that is, and why do you think that that a show like this is needed to kind of help people get back in the kitchen and do that?
Two reasons. One is that a lot of people are under the impression that good food is more expensive, and it isn't. And that's one, I think, the great lessons that Robert Irvine has shown here at Fort Drum. Is the government mandate, the government allocates, the Pentagon allocates a certain amount of food per soldier per day for 3 meals a day. He is beating that number by 26% and giving them real food. Before he came in here, the metric for purchasing food was just shelf life. So they were buying cheap food, and the only thing they cared about was that it would last a long time on the shelves. It was terrible for the troops. They were only eating about 1/3 of it. 2/3 was being thrown away. Chef Irvine came in, changed the ingredients so that many of the ingredients are locally purchased within a few miles of Syracuse, and gave them good, fresh food that is freshly made every day here, made to order, at a savings of 26%. When we first discussed this program, when I first discussed it with Chef Irvine, he said, "We don't need more money to give good food to people. We just need to buy smarter." One of the things this show does is it teaches people how to buy smart so that they can feed themselves on $3 to $5 a day, or $3, $2 or $3 a portion. And at the same time, many Americans, one of the big impediments that we face, many Americans have forgotten how to cook. This ultra-processed food are so convenient. They're not convenient over the long term, and they're not cheap over the long term because you get diabetes and other chronic disease. One of the things that we need to do now, and we're doing this across our agency and many, many programs, is teaching people how to cook again, how to buy groceries, how to buy cutlery, and then how to come home and cook it. Fast food, there's only an illusion that fast food is less expensive. A Big Mac meal costs $12 to $14. You can feed yourself 3 good, healthy meals a day for less than $10.
Any further questions?
Thank you all very much. Hi, I'm Robert F. Kennedy Jr., your HHS Secretary. Welcome to the Real Food Show. Thanks to President Trump, we flipped the food pyramid and put real food back where it belongs, at the center of the American plate. I'm traveling across America, connecting with renowned chefs to show families how to cook delicious, nutritious meals with real ingredients, all at affordable prices. America, it's time to eat real food. Let's get cooking.